The following program is sponsored by Capital Blue Cross. El siguiente programa es auspiciado por Capital Blue Cross.
Bienvenidos, amigas y amigos, a una nueva cita con su salud. En el día de hoy vamos a estar conversando sobre temas importantes sobre la salud. Uno muy importante que es la casa donde nuestra salud es cuidada. Ese lugar a donde nosotros vamos, donde un personal calificado va a tomar el cuidado, tomar las riendas del cuidado de nuestra salud. En el área de York tenemos a Family First Health, quien es un centro federalmente calificado para exactamente hacer eso, para el cuidado de nuestra salud. Vamos a estar conversando con Jenny Englert, quien es la directora ejecutiva, la CEO de este centro, que nos va a estar dando un poco de información sobre qué significa para un centro ser calificado federalmente y qué significa eso para nosotros poder darles a ellos las riendas de nuestra salud. Jenny, thank you so much for being here with us today.
Thanks for having me.
It is such a pleasure. And I was saying in the introduction that Family First Health, being a federally qualified healthcare center, what does that mean? What does it mean to be a health center qualified by the federal government to provide healthcare?
It means that, first of all, the communities that we serve have been designated as areas that have struggles with access to primary medical and or dental care and or behavioral health. And the federal designation allows us to attract and retain providers. It also allows us to operate in areas that may otherwise have difficulty supporting medical or dental services in their particular communities. Because of that designation, though, we're held to very high standards around the clinical care that we deliver, as well as our fiscal oversight and the way that we manage our operations. So in many ways, the patients that come to our centers may see us as a regular doctor's office or dentist's office, but we like to say that we are that plus so much more for the communities that we serve, because we are really designed to make sure that we're meeting the unique needs of each of those communities. And the communities that Family First Health operates in are very unique. York City is very different than Hanover, is different than Northern York County, is different than Adams County. So we strive for standardization in the quality of care that we deliver, but we also want to make sure that we're addressing the unique cultural needs of each of the communities that we serve, because they're very different.
So first and foremost, the areas in which you're serving have been identified by the federal government as areas that are otherwise poorly served.
Yes.
In other words, there's lack of access to quality health care.
Yes.
Now, once the federal government identifies these areas and you are granted the qualification to serve the community, the federal government just says, here's your qualification, go ahead and do it, and that's it? Is how does that qualification, how do you keep that qualification?
They definitely keep tabs on what we do. So that qualification isn't just a free rein to deliver care in any way that we see fit. We have a lot of oversight of the fiscal responsibility. We do receive federal funds to help support what we do. And so they're definitely interested in our oversight and management of those funds. In addition, and probably most importantly, they're very concerned that the patients that choose us as their medical home get the highest quality of comprehensive care that is possible for us to provide.
Now, does this type of oversight happen in every medical practice?
No. Interestingly, most of the private practices in our community wouldn't be held to the same level of accountability as a federally qualified health center like Family First Health.
So would you consider that the federal qualification should be something that the public should see as an additional level of safety and security that the healthcare service that is going to be provided in your centers not necessarily of higher quality, but just as good, if not better, as anywhere else.
Absolutely. If we were thinking about a star rating, which we see so much today, I think that designation gives us at least a good 3 to 4 stars right out of the gate because of those things that we're held accountable for. And it is really important, the point that you're making, that just because a community may be designated as underserved or have high levels of poverty or few doctors or dentists that choose to practice there, doesn't mean that the quality of care that they have available to them should be lesser in any way. In fact,
so this is actually, you know what, you don't have the healthcare services, we're going to give you whatever.
Right.
No, we're going to give you the best.
Right, absolutely, because we know that actually many of our patients living in those communities have even greater challenges than their peers in other parts of our county. So we recognize that things like transportation, language, culture, the environmental conditions in which they live, all may have potential negative impacts on their health. So we try to see all the communities that we serve through a lens of what are the strengths in those communities and how can we capitalize on those, along with being aware of what are the individual challenges in those communities and how can we help address those.
Now, what areas do you cover right now?
The entirety of York and Adams County, and to do that, we have sites spread throughout York County, so northern York County, 2 sites in the city of York, 1 in Hanover, and a site in Gettysburg as well.
So you're covering quite a large area that certainly would not, or at least would be insufficiently covered if you were not there.
Absolutely. Our 22,000 patients that choose us as a medical home would have limited, if any, options if we weren't present in those communities.
Bueno, damas y caballeros, estamos conversando con Jenny Englert, quien es la CEO, es la directora de Family First Health, que es un centro calificado federalmente para proveer servicios de cuidado de salud en las áreas actualmente de todo el condado de York y el condado de Adams. En estos momentos tienen oficinas, 2 en York, una en Hanover, en el norte del condado de York, y también en Gettysburg. O sea que es un servicio, un sistema, vamos a llamarlo, comprensivo de cuidado de salud, donde se está tratando las áreas donde un centro calificado federalmente para el cuidado de la salud, donde ellos proveen la salud, son áreas que el gobierno federal ha designado como áreas que están subservidas por los servicios tradicionales, es decir, los hospitales tradicionales, los médicos, las oficinas de médicos privadas a las cuales nosotros estamos acostumbrados a ir, no hay suficientes y por lo tanto la comunidad está subservida. Muchas veces esto significa que son áreas donde hay alto índice de pobreza, donde hay ciertos, vamos a decir, problemas culturales que hacen más difíciles para que otros sistemas tradicionales den este tipo de cuidado de la salud. Entonces, el gobierno federal califica a oficinas o a instituciones como Family First Health para que ellos sean los que se encarguen de proveer. Esto no es una calificación que simplemente el gobierno da una vez y después dice, bueno, vayan a hacer lo que ustedes quieran. Todos los años, todo el tiempo, el gobierno federal está con un ojo avisor revisando qué es lo que están haciendo, qué es lo que está pasando con las finanzas de centros como Family First Health, para asegurarse de que la comunidad está recibiendo el servicio que la comunidad se merece. Entonces, cuando usted ve que un centro tiene este tipo de calificación, usted tiene una seguridad más de que el servicio o los servicios de salud que van a ser, que le van a prestar en estas áreas, están muy por encima en muchas situaciones a lo que usted puede recibir en cualquier otro lado, exactamente porque el gobierno federal está mirando cuidadosamente a cuáles son los servicios que se están dando en estas áreas. Now, Jenny, what are those services? If someone is moving for the first time into the York area and says, I'm looking for my doctor, what would be the services that that person would be able to find Family First Health?
So normally when somebody is new to an area, some of the most important connections they can make are around their medical care. And our scope or focus is family medicine. So we really want to provide care for the entire family. That's what the strength of the model is. So children can come
Hence
to our
family
center.
first.
That's right.
Yes.
So children can come to our health centers from newborn through adults and certainly those that are aging. And for us, the beauty of that model is that we can be taking care of mom, dad, kids, grandparents, aunts and uncles, and really get a sense of the social context of the family, which is really where health happens. It doesn't happen in our offices. We provide tools and resources and coaching and advice, but health happens in people's homes and in their communities and in their churches. And so the more that we can understand the social context of the communities that we serve and the families that we serve, the better results our patients will get. So in addition to medical care, though, we would say as important, it is imperative that people have a dentist that they can identify with, be seen on a regular basis.
That is less seen. We generally just go to dentists when we have pain, correct?
Oftentimes.
And a lot of times that's already too late.
Absolutely.
For quality care, correct?
Right. Over time, I don't know how it's happened, but we've separated the mouth from the rest of the body as well as sometimes the brain, right, or the mind. And so we want to connect all those pieces back together. And we do know that oral health is incredibly important to somebody's overall physical health. So it's very important that not only is that person who might seek us out, be new to the community, or wanting to engage in their health care for the first time for whatever reason, not only connect around our medical care, but our dental care as well. And again, it's a family model, so we're taking care of children up through adults and welcome all members of the family, both for medical and dental care.
You talked about the mind. What are you doing in terms of mental health?
So again, to try to put the body back together that we've maybe consciously or unconsciously separated over time, we strive to have an integrated health program or a coordinated behavioral health program, or coordinate those services that are behavioral with those that are physical. And we do that by having a member of our team in the medical office. So during that regular medical visit, a member of the team that's available to the patient has a behavioral health background or training or expertise. We screen all patients regularly for depression. That's a real area of focus for us, but because we know, one, there's high rates of depression in our community. We also know that depression coexists with many other chronic illnesses and really can help, can prevent people from achieving good overall health. So we do lots of screening, and then for those patients who screens indicate that they might need some additional support, the medical provider can bring right during that medical visit the behavioral health consultant into the visit, introduce them to the patient, and then that behavioral health consultant can introduce them to the behavioral health services that we have available. Then behind the scenes, based on the patient's direction and their goals, the medical health professional and the behavioral health professional can consult with one another to determine what the best course of action might be or options might be for that patient.
Now, you can't talk about the whole family and leave out pregnancy. What happened with those 9 months of expecting a new baby? Do you also provide care for pregnant women?
We work in partnership with OBGYNs in our community to actually focus on those 9 months. We really believe those 9 months are the groundwork for those are laid by all the work that our family medicine providers do on a regular basis. That's what sets up a healthy pregnancy. If somebody understands their overall health prior to becoming pregnant, has the opportunity to plan their pregnancy, and then, as I said, we work with those partners in our community that have expertise in that OBGYN care for those 9 months. Then we receive that woman and her child back into our practice so that we can make sure that that care that was started before the pregnancy can continue.
Can continue. So we could say that Family First Health and all of their centers is like a one-stop healthcare mall, one way or the other. You can really take care of your whole healthcare needs?
We can serve as that focal point with the patient. So we do value our partners in the community. There are health care issues that extend beyond our scope, but that's where we have kind of forged the way for our patients. We've determined those relationships that work well, whether it's for OB care or for cardiology care or other needs that a patient may have. We've already determined the path so that our patients aren't left to navigate
and
that
you're at the
on
home.
their own.
Once
Right.
you go to the cardiologist, then you come back, how did it go? Once you go to
Absolutely.
the OB or the gynecologist, then you come back and you say, how
That's
did
right.
you have the results? You're the
Right.
hub where that
Right.
healthcare.
And often we're helping provide that translation, whether figuratively or literally, of what happened during that specialty visit, so that a patient can really understand what occurred in the context of their overall primary medical care. And we find that's a really important role that we serve.
Now, we talk about, certainly, your existence comes from the prevalence of hurdles for people to access healthcare, correct? And just the fact that you open doors doesn't mean that people already understand, oh, I don't have those hurdles anymore. What are
right.
your biggest challenges in getting patients through the door and realizing this is a place that you can trust for your healthcare needs?
I think that word trust is important that you used, and I think I'll mention two things. One is that I think the primary hurdle is, in many of the communities that we serve, helping to create structures in which people value their health and see a future for themselves and their families, and understand that being healthy is key to being able to attain their future goals. Some of the communities, all of the communities that we work in, have struggles at some level with poverty, with housing insecurity, with food insecurity, and those are big issues for people to navigate every day. So for us to say, hey, we opened a health center and we expect you to now care about preventing illness or thinking about something that may happen in 20 years, that's a really big leap for some individuals. And many times there's been experiences in the past which have caused them to distrust the healthcare system or systems in general. So that for me is the biggest hurdle, is being situated and positioned in a way that the community trusts us, sees us as welcoming, and sees us as an asset or benefit to them, their families, and their lives and their future goals.
Do people have to pay? How do you get reimbursed? How do they have to have health insurance to be a patient at Family First Health?
We really try to help in any situation that a person comes to us with. So financial means are not a limitation when people come to our medical or dental centers. We either have an opportunity to help connect them with insurance, so actually do an enrollment right there with them for either public benefits or private benefits through the marketplace. We can offer, if that is not an option for them, we can offer a reduction in their fees based on their family size and income, or we accept a wide variety of insurances, almost 50 medical insurances and 20 to 30 dental insurances. So we really try, and we fully participate in those insurances.
So everyone and anyone is welcome, regardless of what their insurance needs or where the money is going to come from to
Absolutely.
pay for the services.
We just want people to keep coming. We recognize that insurance status is vulnerable. One day I may be insured, the next day I may not be. We want people to see our centers as places where they come no matter what those changes are, and we'll figure it out. But that the medical care or the dental care is consistent and not based on the fluctuation of insurance or income, which happens to everyone across the course of their lifetime.
How is this different than the concept of a free clinic?
There are several key differences with free clinics, and I would say the primary difference is we're not free. And the expectation of the federal government is that we are not a free clinic. That is a different type of care and a different design of care. All of our staff are paid. We don't have volunteer staff providing care. We don't have volunteer doctors or dentists. And
So this is not a place where I can say, well, Dr. Jim is my doctor, and then I come in the next day, but he's not volunteering, so He's not my doctor anymore.
Exactly.
My doctor is my doctor once
Right.
once I'm there.
And your record is available to all of our providers. It's consistent. The care that someone's received over the course of their time with us is well documented, so that both they have a primary care provider, but should that person be on vacation, should they leave the community, the care can continue at the same level in which it's always been provided.
Bueno, damas y caballeros, conociendo un poco más sobre los servicios que Family First Health provee a sus pacientes en los condados de York y Adams, tenemos que es básicamente Family First Health es considerado como un pequeño centro comercial para la salud, siempre y cuando estamos hablando de lo que se llama la salud familiar, desde niños hasta adultos. Se proveen los servicios de salud en todos los campos de la medicina familiar y la odontología, un área que desafortunadamente ha sido tan olvidada en el cuidado de la salud. Usualmente la mayoría de nosotros desafortunadamente solo vamos al dentista en el momento en que estamos ya sintiendo dolor. El ideal, sobre todo con todas las áreas de nuestra salud, es la prevención, es las visitas continuas a los servicios de salud para prevenir exactamente esos dolores y esas situaciones donde las situaciones de nuestra salud se convierten en una emergencia. Entonces, Family First se encarga del cuidado de la salud desde la pediatría, los servicios de medicina familiar para todos los miembros de la familia hasta la adultez, y también el cuidado de las mujeres embarazadas, el proceso del embarazo, la importancia de que una mujer conozca su salud antes de quedar embarazada para así saber cuál es el pronóstico, vamos a llamarlo, de ese embarazo y cómo cuidarse durante ese embarazo. Y por supuesto, una vez que el bebé nazca, tiene una casa para su salud. Siempre tomando en cuenta que como este es un centro de cuidado de salud que está calificado federalmente, estos servicios, si bien no son gratuitos, están garantizados para todos, indiferentemente de cuál sea, de dónde va a venir ese dinero. Existen, por supuesto, por los subsidios federales que recibe Family First Health, que estos servicios puedan terminar siendo gratuitos para la persona, pero eso no significa que son gratis, eso significa que están subvencionados. Esto quiere decir que esto lo separa de aquellos servicios caritativos donde usted puede ir a obtener servicios de salud, pero que depende de quién sea el voluntario, de quién sea la persona, ese va a ser quien lo va a ver en ese momento. Este es su casa de familia donde su historia médica es compartida con un equipo de cuidado de salud, indiferentemente quién esté de vacaciones o quién ya no esté trabajando o sea nuevo trabajando para el lugar, va a conocer completamente su salud porque es como cualquier otro centro de cuidado de salud, en el sentido de no solamente la calidad, sino también en la continuidad del servicio. Now, Jenny, what are the challenges for the future of Family First Health? Is there a moment in which you can say the job is done? What are the challenges?
I think I would be kidding myself if I said it was done. I think the pursuit of health for the entirety of the communities that we serve is something that will continue on long beyond my time in my current position. And I think that's good. I think that's okay. The way that we approach health and health care is evolving rapidly right now. So that's a challenge for us. We are doing in our center all the same things, thinking through all the same issues as large health systems around us. And we're doing that with fewer resources. And so we have to be creative, and we have to be knowledgeable about the unique needs of the communities that we've historically served, but not get caught in that legacy trap. We need to think about what's next, what is the vision of health for the communities that we serve right now today, and what will it be in the future, and then what could the role of our health centers be in meeting those needs. Continuing as it's been, it's something to be very proud of to have a 45-year history in our health center. But it's something that we also can't rest on. We have to think about what the next 45 years look like, and how we position our health center so that those that come after us, that lead after me and all of the staff that I get to work with every day, how we position the health center to be successful for those folks, and continue the mission that was developed 45 years ago.
One of the big changes, recent big changes, I would say, is the Affordable Care Act.
Absolutely.
And many could have said, well, now that everyone has health care that has insurance, then federal qualified health care centers are not needed. What has changed, and what do you see happening around the Affordable Care Act and the services that you provide?
I think that our role can be more important than it's ever been. As more people have access to insurance, one, we have to make sure that those populations that we are connected with understand what that means, how to access that insurance, how to use that insurance to better their health and their lives. And there's been inequality in access to insurance for so many decades in our country that flipping the switch, signing the Affordable Care Act was just starting us down a path. And health centers are really fundamental in helping us take all citizens down the path towards having that health insurance is foundational, but then understanding how to access the healthcare system appropriately so that they can meet their healthcare goals, whatever they are. And health centers are uniquely positioned to do that because we're connected with those communities that have typically or historically been maybe disconnected from some of the traditional healthcare providers in our community. So we can really help continue to do, maybe in new ways, but what we've always done, which is bridge that gap for those in the community that may, without our existence, be left behind. And that's always our goal, to make sure that no one is left behind in all of these changes, big sweeping national changes, state level changes, that every member of our community has an equal opportunity to fully participate in the healthcare system.
The healthcare system. Well, thank you so much for being here with us, and we wish you the best next 45 years.
Thanks so much.
And your tenure there in Family First Health is a very productive one.
Thank you.
Bueno, damas y caballeros, aquí lo escucharon. El futuro de centros como Family First Health, centros calificados federalmente, está más fuerte que nunca, incluso con todos nosotros ahora teniendo acceso a seguros de salud. Indiferentemente, ahora se trata de asegurarnos de que todos tengamos la oportunidad de utilizar plenamente esos seguros de salud y de tener el acceso a cuidado de salud que sea que nos merecemos todos juntos. Les invitamos a acercarse a las oficinas de Family First Health para ver si es ahí donde usted pueda encontrar esa casa para su salud. Y obviamente la invitación es para la próxima cita con su salud aquí en Telecentro.
The following program is sponsored by Capital Blue Cross. El siguiente programa es auspiciado por Capital Blue Cross.